cardiovascular pathology. Here I'm just going to be wrapping up pretty much everything else that's in the cardiovascular pathology section that doesn't really have anywhere else to go. First thing is hereditary hemorrhagic telangiectasias. Okay, all you need to know is that this is vascular malformations are going to be seen. So arterial venous malformations are going to be seen with hereditary hemorrhagic telangiectasias. And you're also going to get a patient that has bloody noses a lot, and they have these telangiectasias located throughout their skin. Okay, so they have epistaxis, which is bloody noses, with telangiectasias on their skin. Okay, it's also called Osler-Weber-Rendu syndrome, and that's really all you need to know. It's just a disorder of the blood vessels. Okay, so 1, you're going to have vascular malformations. 2, you're going to have bloody noses, so epistaxis, and 3, you're going to have telangiectasias. Very straightforward. That's all you need to know about hereditary hemorrhagic telangiectasia. Lastly, we have the cardiac tumors. They surprisingly like the first one that I'm going to be talking about, myxomas, so much, and it's weird, but you're not going to see too many questions on it, but it's relatively in yield. So for the first one is myxoma. What you need to know is that they mostly occur in the left atrium. It's a weird question, but I've seen probably 3 questions asking where the myxoma is occurring. It's going to occur in the left atrium. And by the way, once again, these are all cardiac tumors. So they're very rare, right? The most common cardiac tumor is going to be a MET, but we rarely have any cardiac tumors. So this one is a myxoma. It's mostly going to be in the left atrium. Okay, what they will say in the description pretty much every single time is that you'll hear a tumor plop. Okay, so if it's a blob or a plop, if you see that on auscultation, then your answer is going to be myxoma. I think every single time that I got it right, they gave me that it said a plop. So if you hear plop, it's a myxoma, okay? And they can ask so many different questions on it. They'll give you plop, but you have to know what question they're gonna ask, okay? So here that is. If you hear plop, you can put left atrium if they ask about location, right? Because that's the most common location. If they ask about histology, it's going to be a gelatinous material with myxoma cells, okay? So they're going to have scattered cells within a mucopolysaccharide stroma. So I think of just gelatin, mucopolysaccharide, mucus, random stuff like that. It makes me think of myxomas, okay? So that's another question they could ask is the histology. And then its association with IL-6 production, okay? So the tumor produces IL-6. That's the last question that they might even ask. I don't even know if they ask, but just make sure you know that plop and then the left atrium as well as what it looks like on histology, okay? Rhabdomyomas really aren't high yield, so I'm just going to skip over it. That finishes our section for cardiovascular pathology. I hope it was really helpful. This is honestly the most in-depth material. What I would recommend you do is definitely, listen to these videos. They're very, very helpful, and then go through UWorld as if you don't know anything, okay? So answer the questions on UWorld and then read the whole entire UWorld question, explanation, okay? Those are your most helpful things. That's your best friend, and put all the information that you learn in UWorld in your book next to the location that it denotes, all right?